All right, so we are live. Good morning, everybody. Good morning, and welcome to Meet the Press with Lovejoy. My name is Lovejoy Mjongwiza on your favorite program, on the program where we bring you everything from everywhere, where we meet with everyone from every place of this great country and this great world. So, before we get into today's program, we just want to run past just a few things regarding the COVID-19. Looking at the statistics from yesterday, we can see that yesterday Zimbabwe recorded 4 new cases and 1 death, which is quite okay because over the past few weeks we have been receiving quite a number of COVID-related deaths and new cases. But we've seen that there's been a decline in COVID-19 cases over the past few days and weeks, which is highly commendable. And this is largely because you are playing your part in doing everything that is possible to ensure that we get as less cases as possible. Most people are also getting vaccinated, which is a good sign. Statistics from the Ministry of Health yesterday say that yesterday alone, 3,045 people were vaccinated yesterday. They received their first doses of different vaccines that we have in the country, whilst the cumulative number for first doses has risen to 68,511. And yesterday again, 2,663 people received their second doses, bringing the cumulative numbers for second doses to 10,628 as at yesterday 4 p.m. This is quite commendable. Looking at where Zimbabwe started this whole vaccination process at, we were lagging behind, but I think in the last 5 or so days, we've seen the numbers escalating. And this is because maybe the president also got vaccinated and his cabinet minister, they also got vaccinated. So there's a bit of confidence now going into the second phase of the vaccine. From this program, I'm also going to get my second shot of the vaccine. You should also do the same. However, this is not why we're here today. Today, we are here for something exciting. We, as Meet the Press, our aim is to get into communities, to meet up with you, talk to you, hear your stories, and we share with the rest of the world. That is why we call it Meet the Press. And we recently went to Lomboshawa, where we tracked one of the biggest innovations to come out of Zimbabwe. Of course, it's not alien around the world, but it's new in Zimbabwe. So there's a company that is coming up with what they're calling Zimbo's Abantu mobile clinic, right? So this is a former combi. I'm sure most of you know your commuter buses, the ones where we sit 4-4 in Shika, right? This is a former combi which has been converted into a fully functional mobile clinic, right? So this is a clinic that is coming out of a combi, and it's not just an ordinary clinic. It's a clinic that is powered by solar and wind energy. So we tracked down the guys behind this innovation. We wanted to hear their stories, them meeting the press, and we are here with them. This is their story. We'll play you their interviews, and then you can hear for yourselves what these guys are up to. I hope you enjoy the show.
Jonathan Mshawedu. I am the founding CEO of Regain 37. We have a project that we call Smart Health. That is in the smart health space, and Zimbo's Abantu healthcare on wheels. So basically, what we have here is a concept where we are making use of telemedicine, so that we cut on the distance that women travel and children travel from their homesteads to local clinic. Our research tells us that 40% of the population has to travel more than 5 kilometers to the nearest clinic or hospital. So we are, really covering that gap. So basically, we have entered an MOU with Maisha Medic, who are, they've got a telecenter They've got a telecenter for basically doctors where the patients call in So we are providing that experience through basic laptops or tablets. So our nursing staff here in the mobile van, they've got access to doctors through a mobile center. And all that is powered, as you will see on there. We've got a power charge point where we power all these gadgets. We then also have working on a dispensary for medicine. So once the patient is talked to, the vital signs are taken for the patient, we enter all that and capture in electronic health records platform, where the doctor sitting somewhere in Harare will then have access to the patient's records and recommend the next the precise diagnosis. So that's basically what we are all about. When we're saying we are powering our health care through solar and wind, because that is a typical gap that exists in the rural areas. There's no power, there's no electricity to power these basic uses.
Okay, maybe as a follow-up to what you said, especially the last point, you say that you have to make sure that doctors have access to their patients and they log in their details, blah, blah, blah. What about those people who do not have access to the internet? I understand most of the rural folks here might not have access to the internet. How do they have access to their doctors? How do they get in touch with the doctors?
Yeah, so the mobile van comes with internet access. So we have internet access as we speak in the van, so that we power this gadget and connect them to the internet. Then the internet becomes the platform, the gateway to access the doctor who is sitting somewhere in a call center. So we then have a virtual video consultation with different doctors in different call centers, different specialists as well for different ailments.
For someone who's seated here in Goromonzi, right? He's got the ones that you call the Mbudzi phones, right? They want to access this vehicle. They've got a problem at home. They want you guys to be there at their place. How do they go about the whole process?
So basically, we're working with community leaders for pre-booking. So we can reach out to a counselor, we can reach out to church leaders, and then kind of pre-advertise that we'll be coming to this area. So that way we have so the platform actually allows us to pre-book appointments, so that whenever we come, we know that there'll be people waiting for us, patients that will be waiting for us. So that's basically how we will operate here.
All right. And let's talk about the issue of innovation and green energy. I think these are the issues that you're also bringing up apart from access to health.
Sure.
How do you envisage communities to be adopting to this, the whole concept of innovation? You said this, I mean, one of you guys said this was a vehicle maybe for kids or maybe for passengers, but now you remodel it into this, and you've got solar energy and wind energy going on. How do you envisage other people to come into or to buy into this technology that you're using?
Yeah, so basically, we're using, it's a productive use of energy. So we're taking this to the next level. So basically, we are looking at, powering the freezer, which is a temperature control freezer for vaccines. Everybody right now is thinking about vaccines. We believe that we provide the last mile delivery for vaccinations. Not only that, you realize that even COVID-19 tests, they also require some level of refrigeration for the swabs. Once we collect swabs, this is something that we are keen on working on, so that we help out when it comes to vaccinations, when it comes to immunization, when it comes to screening, all sorts, and all these equipment. At some point, they need temperature control.
In as far as access to health is concerned in Zimbabwe, how important is this concept?
It's very critical. Personally, this is more like an emotional investment for me, because my mother died of a wrong diagnosis. And I remember we had to go around in different places. So basically, this kind of, covers that gap. We're trying to fill in that gap where, there's not so many clinics against the population that we have. Like I said, 40% they have to travel more than 5 kilometers, and that's a lot. For someone who's sick. So perhaps this model, if we scale it up, should be able to really help in that way. And more so, during the lockdown, you realize that a lot of people were scared to go to the clinics or hospitals for one reason or the other. So you realize that the closer proximity to the patient always helps, and there's no better solution than healthcare on wheels.
I think one of the most important questions that we can ask right now is because we look at it and then it's mobile vaccines code what's something that's written there. One of the key questions I think that we could also ask along the way is, are you guys offering COVID-19 vaccines, or maybe you're offering other vaccines?
It's not just vaccines, it's not just from when anyone is a child, they get vaccines or immunized against a lot of ailments. So it's not just a COVID-19, it's just a topical issue because that is what is leveling the country at the moment. But really, it's a solution that we also provide with different partners. We are keen working with the government, we're keen on working with private sector so that we get the last mile delivery for the vaccines. One of the things that we also want to ensure is that imagine a big farm that is 500 employees, or a big factory that has 1,000 employees, or a mining company that has a lot of employees. You can't really take them all of them to a vaccine center. It means you're losing out on productivity. So that's one of the things that we are keen to occupy that space so that we bring vaccines at the workplaces, at the workstation, keeping the companies productive in the way, after we bring the vaccines to them. So I think that's an area that we are so keen on. But immunization is so broad. It's not just COVID-19. Yeah.
But maybe back to the vaccine, COVID-19 vaccines. We are now in the era of vaccinations. The vaccination is going on.
Yeah.
How handy is this set up, especially in areas like this, where people might not be able to go to, let's say, Harare or maybe Goromon Center to just access those vaccines?
Precisely. Our solution is quite a robust solution because we're powering this with green energy and with temperature control. So the freezer can easily do it 2 degrees to 6 degrees, which is what the Sinovac currently takes, and most of the other vaccines, other than AstraZeneca, we should be able to comfortably do that in our solar freezer here. So it's a space that we are so happy and keen to occupy, and it's viable. It's all about scalability for us, so that we have more in each province, in each district, in each ward, so we can be able to occupy that space. But cold supply chain is very critical to the success of the rollout of the vaccines.
All right. I think maybe one of my last questions. I want to take you back. You talked about your mom dying because lack of access to health facilities. Was that the inspiration behind you coming up with this project?
Yes, perhaps I can say that it's partly that inspiration, but obviously as a company we also work in the education sector, so we also realize that these are some of the gaps that we come across whenever we go to rural areas and rural schools. So there are not so many clinics whenever we are traveling around, so that gives us that motivation to say, okay, how are we going to use smart energy to occupy and fulfill some of these needs that we have, where there's little help that is there, but a great need that we have.
How many of these do we have? How many of these moving clinics do we have?
Currently, this is our prototype, but we're surely working on more. I'm sure in the next 2 to 3 weeks, we'll be rolling out more mobile units.
And what kind of support would you want?
Yeah, definitely. As a young company, we're looking at investment. So we require a lot of investment. As you can see, that it's not an easy job to be done. From procuring a unit and repurposing it, and then trying to fill up with the medical equipment. So that's not an easy thing. So we're looking for investment. Definitely, we're looking for partners. We're looking for collaborations. So those are some of the areas that preoccupy me as a CEO of the organization. To say how do we get investment, collaboration, and partnerships going on there.
Well, one of the issues that might arise, the issue of health, access to health is a very volatile issue. People would want to know, maybe, are you working with qualified health personnel?
Precisely. Yes, we do work with qualified personnel. We have our nursing lead on this project has got more than 25 years in the health sector. So yeah, we do work with all our nursing assistants. They go through training and all that. So we're definitely high on keeping the regulations in check.
Awesome.
How many doctors or nurses are you working with, or like are taking part in this project?
So at the moment, we can say Maisha Medic gives us access to unlimited number of doctors through the call center. Then right now we have one nursing lead and a nursing assistant. But you know, each and every van should have that same set, at least 2 medical practitioners. So that's basically, you know, how we're operating.
So, do you have any hospitals or clinics we are working in terms of the health education and clinical campaigns?
Yeah, definitely. We're working with, at the moment, you know, we're in the observation mode with Makumbe District Hospital so that we can be able to see areas, gap areas that we can occupy. We haven't, signed off an agreement as yet, but it's work in progress. So Makumbe District Hospital happens to be the district that I am coming from. So it's only natural that we support Makumbe Hospital. And over the weekend, we did something with National Blood Services of Zimbabwe, where we're providing nutrition education in one of their campaigns. So we are very much open and keen to work on collaboration, be it churches, companies, different organizations.
Okay. How different is this from an ambulance?
Yeah, so an ambulance comes in and doesn't do any much in terms of ailments and really looking at a patient on site. What basically does is just transfers emergencies from one point to another. But we are not an ambulance, so we always get that point. We're not an ambulance, we are pretty much a clinic. So basically we have people coming in, they get help from taking their vitals, and getting help and prescriptions and drugs and everything. The whole cycle of the primary healthcare system.
So, give us your vision, like where will you see yourself, like in 5 years?
Yeah, we're here to stay. We're really planning to grow in this space and occupy the mobile clinic concept and to be present in every other district, every other ward. That's our vision, really to be partners of choice when it comes to research elements, of health, areas, when it comes to last mile delivery in some of the remote areas, when it comes to immunization on some of the, hot areas in terms of ailments for children, adults, youths, all those areas. So that's really our vision, to occupy that whole space. And also to be very much accessible even to international partners as well who would want to carry out research with our organization, because we will be almost present in every other area. So we also providing that access to that. Yeah.
This is Shepard Mondiwa. I'm the lead tech guy for this project, Simbo Zabantu, mobile health care on wheels. What we've done here, we have repurposed a van. You can see these combis that we use for our transportation that I've done it for now, and we repurposed it to become a clinic that is actually able to do cold chain supply for vaccine. What we've done is we have incorporated the solar and wind energy to power our gadgets inside. This van was usually used for carrying kids maybe to school, but now we've used it for the clinic. You can come close so that you can see what's inside. We have actually used the things that we have locally. We have repurposed one of the things that we have repurposed this hospital bed into an examination couch. It's actually here in the van, you see. We have incorporated our solar panels on top, our wind energy. We have our backup power supply battery that can go for around 18 hours backup. We have also incorporated water supply system, an elbow action sink for our healthcare workers, and there is a bench there for our medical team whilst they are examining the patients. And most of our things will be housed in this thing. As you can see, we've incorporated some of these things like these shelvings, drawers for our supplies, the crates, you can put them here. Most of our things will be in these drawers. And this van is also powered by AC energy for some laptops and whatever that might be need to be used during the course of the treatment of a patient. So basically from a technical point of view, we have just repurposed an ordinary van into a clinic.
My name is Dr. Mesichi. And acute illnesses, those difficult cases they need help with, we're the ones that come. So we think come here, join us, helping us with the clinics. They've been assisting us with the health education side of the clinic, also helping our patients with things that they need in terms of medication and assistance. And also we thank them for the mobile clinic, because they have a stocked up van that has got most of the equipment that we need that we didn't have.
Ndabatsirika nesevhisi pandabatsirwa nezvabhebhi wangu anoshanda zvakanaka, saka tinongoimba kuti maTuesdays ese wauye wachibatsirawo vamwe semabatsira
Zvamawana izvezvi kana directly now matari now zvamawana
especially pafamily plan apo ndanatsovabvunza vakanatsondibatsira zvakanaka vachinatsokuudza kuti family plan iyi ukaishandisa zvakadai inonatsoshandisikawo zvakanaka. Then pana bhebhi wangu kurekta kwanga achiita vataurawo vanatsondibatsirawo zvakanaka, nekuti ukada kuti kuzvipatara umanesi anenge achivadhonisa zvakawandisa, saka apo vanatsonditsanangurira kuti mwana unozomushandisawo zvakadai kuti zvinhu zviite zvakanaka, saka ndabatsirika papo. Ndotoimba kuti dai varamba vachiitawo zvavari kuita izvozvo, vanhu vazhinji vanobatsirika naizvozvo nekuti vanhu vari free vakasununguka.
I'm Chedza Mshawedu, co-founder and operations director. We are here as Zimbo Zabantu Healthcare on Wheels, a subsidiary of Regan 37 Private Limited that is on an observation mission with Makumbe District Hospital. I'm particularly interested in women and gender issues, which comes under maternal child health, MCH. We believe in our project. We believe that our project will impact significantly on women, girls, and children.
Did you know that in Zimbabwe there are about 220 hospitals and 1,500 clinics and rural health centers? Did you also know that most people do have and live within 5 kilometers from these communities? However, and this is important, 23% have to walk 5 to 10 kilometers to get to these centers, and more disturbingly, 17% have to walk more than 10 kilometers to access their nearest health facility.
Put simply, the healthcare system currently cannot effectively cater for most Zimbabweans, primarily due to distance and cost. Zimbo's Abantu Healthcare on Wheels is taking a step to bridge this gap. We are introducing Zimbabwe's first off-grid mobile health education services and telemedicine. We will provide healthcare services with main focus on health education, immunizations, maternal child health, and nutrition, among others. Our vehicles are powered by renewable energy of solar panels, as you can see, and wind. They are fully equipped medically. We also have trained health personnel like myself as well. We will go into inaccessible communities across the country to offer healthcare services.
Our mobile health van will also offer other health education services, such as preventative care, lessons on how to treat and take care of those with HIV and AIDS, hypertension, and mental health. Our grand goal as Zimbo Zabantu is to provide healthcare for all and supporting our partners and their own visions, supporting our vision, and also supporting communities and the country to make sure that we all have a place to call home when we need healthcare.